the next question that I can see is that again directed at lymphoma and specifically focusing on follicular lymphoma. So the question is, how often have you seen a patient with follicular lymphoma turn into another blood cancer, or the patient have two blood cancers either concurrently or consecutively? So it does seem to me that the patient is talking about the possibility of transformation of follicular lymphoma, or perhaps with the existence of follicular lymphoma, eventually developing another blood cancer. So, Dr. Sanchina, if you want to answer that.
Yeah, absolutely. So we definitely see transform lymphoma from follicular lymphoma to diffuse large B-cell lymphoma. We're working on a project right now at our institution because we think that in South Florida, for some reason, we are seeing a lot, like a higher rate of transformation than in other parts of the country. So we're trying to figure out exactly what is driving that. In general, the rates are not concrete, right? Some places say maybe like 3% a year, maybe 30, like 1/3 of patients around in 10 years. And then other patients say, almost like a smoldering myeloma to myeloma, maybe you plateau after 10 years, right? If you don't transform after 10 years, maybe you're not going to transform. It definitely is a different type of lymphoma than a de novo lymphoma, right? Again, even in follicular lymphoma, there is a spectrum of follicular lymphoma. So you have, a follicular lymphoma grade 1, which is really truly indolent. And then you have a follicular grade 3A lymphoma, which is almost, already a DLBCL. So it could also be the more advanced that your follicular lymphoma is, the more likely it is to transform into a more aggressive lymphoma. In terms of other lymphomas, you can see obviously CLL transform into diffuse large B-cell lymphoma. We call that a Richter transformation. Again, there are some prognostic factors that we can determine to see if your CLL is more at high risk for transformation, but we really can't 100% predict who is going to transform and who is not going to transform.
Sounds great. Thank you for that.